patient come in last week who looked like they have been hit by a bus. High fever, chest on fire, coughing until they were sick. They were terrified because they had taken 3 COVID tests and all of them were negative. They asked me, Dr. Paul, is this the new mystery virus everyone is talking about on TikTok? I had to tell them the truth. It's not a mystery. It's actually something we know very well. But it has changed in a way that makes your immune system and potentially your vaccine blind to it. And if you think boiling onions or putting garlic in your nose is going to fix it, you are about to make a dangerous mistake. Hello, I am Dr. Suman Paul and I work as an NHS and private respiratory consultant here in the UK. Over the past few weeks, I have seen a massive surge in patients coming in with severe respiratory symptoms. People who are genuinely worried because their symptoms don't match what they are used to and their home test aren't giving them answers. Before we dive in, let me be clear. I am a doctor, but I am not your doctor. This video is for educational information only and not medical advice. If you have severe symptoms, you need to see a doctor or book with me in my private clinic if you wish. But what I am going to do is to give you knowledge to understand what's happening and when to seek help. In this video, I am breaking down exactly what is making the UK sick right now. I am going to explain the flu variant that's bypassing our defenses, why you might have the 100-day cough without even knowing it, and the specific medical treatment that actually work versus the social media trends that could make things worse. By the end of this video, you will have more clarity about this illness, what the proper treatment is, and when you need to seek professional medical help. This could save you weeks of suffering and help you avoid serious medical complications. To understand what's happening, you need to know there isn't just one illness going around. There are 3 main infections that's circulating in the UK right now, and they all feel similar at first but require completely different treatments. The data from UK Health Security Agency shows influenza positivity has spiked dramatically in recent weeks. But this isn't the flu you are used to. The circulating strain this year has mutated to something called H3N2 subclade K. Think of it like this. The flu vaccine gave your immune system a wanted poster of the virus. But this strain has changed its appearance just enough that your antibodies don't recognize it immediately, even if you have been vaccinated. That's why you are experiencing what we call a cytokine storm. Sudden high fever, often going up to 39 or 40 degrees Celsius, severe body aches that feels like you have been hit by a truck, extreme fatigue that keeps you in bed, dry cough that becomes increasingly painful, sometimes headaches or confusion. Important thing to note here is that your flu vaccine is still protecting you from severe disease and hospital admission, but it might not prevent you from getting infected and feeling rough for a week or 2. If you are not completely bedbound but have a persistent dry hacking cough that's lasted more than 3 weeks, you might be dealing with mycoplasma pneumonia, what we call walking pneumonia. Here is why this one is particularly tricky. It's a bacterial infection, not a virus. So viral treatments won't work for this. Standard antibiotics like amoxicillin often don't work for mycoplasma. It requires specific antibiotics which can treat this condition. Without proper treatment, the cough can persist for months. The distinctive pattern for this illness is gradual onset, not sudden like the flu. Persistent dry cough that worsens at night. Low-grade fever or sometimes no fever at all. You feel unwell but can still function day to day. Lingering fatigue that doesn't improve. If you are coughing so violently that you vomit or struggle to catch your breath, you might have pertussis, commonly known as whooping cough. Here is what most people don't realize. In adults, pertussis often doesn't make the characteristics whoop sound, so it frequently goes undiagnosed. The pattern typically looks like this. Starts like a common cold for 1 to 2 weeks, develops into severe violent coughing fits. Coughing so intense you may vomit or can't catch your breath. It can last 10 to 12 weeks, hence the 100-day cough. Highly contagious, especially dangerous for babies and elderly relatives. This is particularly important because it requires specific antibiotic treatment and early treatment can reduce the severity and duration significantly. Now here is what's catching most people out and why you can't just guess your way through it. Because the flu strain has changed and because multiple infections are circulating, you cannot rely on home testing alone. A negative COVID test doesn't tell you what you do have, only what you don't. This is crucial. If you have influenza A, a virus, and take antibiotics, they will do absolutely nothing except potentially harm your gut health and contribute to antibiotic resistance. But here is the flip side. If you have mycoplasma or pertussis, which are bacterial infections, and don't get the right antibiotics, you will suffer for months unnecessarily. Taking random antibiotics from your medicine cabinet is dangerous. You need to know exactly which pathogen you are dealing with. For influenza, antiviral medications like Tamiflu are most effective when you are started within 48 hours of symptom onset. If you wait a week to see if it gets better, you have missed the opportunity for the most effective treatment. This is why proper diagnosis matters and why it matters quickly. Now, I need to be completely honest with you about why getting the right diagnosis matters so much. This isn't just about feeling rough for a week or two. In the past month alone, I have seen several patients who initially thought they just had a bad cough and then subsequently developed severe complications like a pneumonia and in some cases even empyema, which is collection of infected fluid or pus around the lung. Here is what's concerning. These complications often start with the exact same symptoms you might be experiencing right now. A persistent cough, producing phlegm or sputum, gradually worsening breathlessness. The difference between a simple respiratory infection and a serious complication can be a matter of days. What starts as I will just wait it out can progress to something that requires hospitalization, chest drains, or even surgery in some cases. This is exactly why I am so passionate about proper diagnosis. When you know what you are dealing with early, you can treat it appropriately and prevent these complications before they develop. Waiting and hoping isn't a strategy, it's a risk. So let me give you a practical action plan for what you can do right now. While you are deciding whether to seek medical assessment, here is your practical action plan. Phase 1 is protecting your household. Ventilation of your household is crucial. These respiratory viruses spread through airborne particles. Open windows of your house for maybe 10 to 15 minutes a day to flush out viral particles, even in cold weather. But please be sensible about it. Isolation when possible. If someone in your household is sick, having them stay in a separate room or use a separate bathroom significantly reduces transmission to other family members. Surface hygiene. Regularly disinfect high-touch areas like door handles, light switches, remote controls, and most importantly, your mobile phone. Phase 2 is managing symptoms at home. For the cough, honey and lemon in warm water can genuinely help soothe throat irritation. There is actual clinical evidence supporting this simple remedy. For better sleep, if coughing worsens when you lie flat, sleep propped up with extra pillows. This prevents mucus from pooling in your airways. For fever and aches, paracetamol and ibuprofen, if you can take them, can help manage fever and body aches. Follow the dosing instructions carefully and don't exceed recommended doses. If you have any doubt, go and see your doctor. Stay hydrated. Fever and increased respiratory rate cause significant fluid loss. Adequate hydration helps thin mucus secretions and supports your immune system. Phase 3 is stop the social media cures. Please do not put garlic cloves in your nose. It causes chemical burns. Don't drink onion water as a cure. There is no evidence. It delays proper treatment. Don't take random antibiotics from your medicine cabinet. And don't ignore worsening symptoms hoping they will just get better on its own. However, certain symptoms require immediate medical attention. This is a 999 call. Difficulty breathing or shortness of breath at rest, persistent chest pain, blue lips or face, confusion or altered consciousness level, inability to keep fluids down, and symptoms that improve then suddenly worsen. If you experience any of this, don't wait. Seek emergency care immediately. Now, here is the reality many of my patients are facing. NHS waiting times are longer than usual right now because of the surge in respiratory illness. Getting a same day or next day GP appointment can be challenging, and access to comprehensive diagnostic testing in the community is limited. But you don't have to wait in uncertainty, wondering which infection you have and whether you are taking the right approach. In my private practice, we take a different approach. Step 1 is I conduct a comprehensive clinical assessment. I perform a detailed examination to rule out pneumonia. I check detailed symptom history to assess the severity, and I also assess your risk factor and overall health. Step 2 is precision diagnostic testing. I can arrange specific viral respiratory panel tests that check for multiple pathogens simultaneously, including influenza and COVID, along with other common respiratory viruses. This eliminates the guesswork. You get a definitive answer about what's causing your symptoms. Step 3 is targeted treatment plan. Based on your specific diagnosis, I can initiate appropriate treatment immediately. Antivirals for influenza, specific antibiotics for bacterial infections like Mycoplasma or Pertussis, evidence-based supportive care guidance for viral infections. I can also provide clear advice on when to escalate care if needed. Let me explain why this matters. The difference between guessing and knowing can be significant. Starting antivirals within 48 hours can reduce flu duration and complication risk. Identifying Mycoplasma early means starting the correct antibiotic, not wasting time on ineffective ones. Ruling out serious complications like pneumonia provides peace of mind. This will help you getting back to work quicker and go back to your normal life faster. Whether you are a busy professional who can't afford 2 weeks off work, a parent worried about your children, or someone with underlying health conditions who needs to be extra careful, having quick access to proper diagnosis and treatment makes a real difference. If you or your family member are experiencing persistent or severe respiratory symptoms, don't wait and wonder what you have. I have put a link in the description box below where you can book a private consultation for a comprehensive respiratory assessment. I have appointments available, including urgent slots for people who need to be seen quickly within next few days. Remember the key takeaways from today. Multiple respiratory infections are circulating in UK right now, not just one mystery virus. Different infections require completely different treatment. Proper diagnosis beats guesswork every single time. Home management has limits. Know when to seek help. This winter season is challenging, but with the right diagnosis and treatment, you can recover effectively and protect your family. If you found this information helpful, please like this video so others can find accurate medical guidance. Subscribe for more evidence-based health information. I am Dr. Suman and I look forward to helping you get back to your full health soon. Thank you for watching. See you in the next video.